this is a disease that historically has not really had a cure. Once this is in the body, it just kind of keeps growing back. And so patients often have required many different procedures over the course of their life. There are some patients that have had to have hundreds of different procedures, each one carrying more and more risk in damaging the vocal cords, changing the voice, hurting the airway. But there's always has been a recurrence rate that we've had to deal with, and it's been different for every patient. PAPZIMEOS is different than the other treatments. It's really trying to get at the underlying cause of this, which is that HPV virus. And it's a drug that activates your own immune system to attack the cells that have this virus in it, thereby reducing the disease, hopefully from coming back once you remove it. PAPZIMEOS works by educating the immune system to target the cells that have the actual virus in it, which is very different than any other treatment that has been previously available for RRP. We deal with these patients that I mentioned before have sometimes literally have had hundreds of surgeries in their lives. And not only is there increased risk for all these interventions, but it really is a life disruptor. The main study was a trial that looked at individuals with a higher rate of disease. They had to get sort of a clean out procedure of some sort to reduce the papilloma burden. And then they were given 4 shots over a 12-week period and see if there was recurrence of the disease. And what they found was about a little over 50% of those individuals that got this treatment, if they had, let's say, 3 or more surgeries in the prior year, the year after, if they were complete responders, they had no surgeries needed. Indicating that they didn't have recurrence of the disease. PAPZIMEOS allows folks to maybe get ahead of needing repeated procedures where you need to have surgery after surgery after surgery, causing significant morbidity and hurting the voice. That's a paradigm shifting treatment. Our voice is our second face. It takes away that aspect of yourself when you have to have procedure after procedure. So having an alternative therapy where we can maybe reduce the morbidity for our patients and reduce that potential outcome, it's a really big deal for us to be able to try to bring this forward. Because I think it's important that they understand what options are available and understand that there's a potential to alter the overall disease course and reduce the number of surgical or other procedural interventions needed.
What is PAPZIMEOS? PAPZIMEOS is a type of immunotherapy used to treat a condition called recurrent respiratory papillomatosis, RRP, in adults. Important safety information. What is the most important information I should know about PAPZIMEOS? Some people may have a reaction to the shot. Signs and symptoms may include redness, pain, swelling, itching, or warmth where the shot was given. After your first treatment, your healthcare provider will watch you for at least 30 minutes to make sure you're feeling okay. Please contact your doctor immediately if you develop an infection, the reaction to your shot worsens, or you experience any of the below symptoms, which may indicate a systemic allergic reaction: difficulty breathing, widespread rash, facial swelling. Thrombotic events, blood clots that block your blood vessels, may occur after your PAPZIMEOS shot. Please notify your doctor immediately if you have the following symptoms: shortness of breath, chest pain, leg swelling, persistent abdominal pain, severe or persistent headaches, blurred vision. What should I know before taking PAPZIMEOS? Before taking PAPZIMEOS, tell your healthcare provider about all of your medical conditions, including if you are pregnant or plan to become pregnant, because it is not known if PAPZIMEOS will harm the unborn baby. If you are breastfeeding or plan to breastfeed, it is unknown if PAPZIMEOS is present in breast milk or how it affects the breastfeeding child or milk production. Talk to your healthcare provider about the best way to feed your baby during treatment with PAPZIMEOS. What are the most common side effects of PAPZIMEOS? The most common side effects include pain, redness, or swelling where the shot was given, feeling tired, chills, fever, muscle aches, nausea, feeling sick, headache, increased heart rate, diarrhea, vomiting, sweating a lot. These are not all of the possible side effects of PAPZIMEOS. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also report side effects to Precigen Inc. at 1-855-PGE-NRRP, 1-855-743-6777. Please see full prescribing information.